Chronic low back pain. It's gotta be one of the most common, and let's be honest, frustrating medical mysteries out there, right? You know something is wrong, but then what happens when the scans don't show a clear culprit? Well, today we are diving into a really fascinating study that might just offer a new piece to this whole puzzle, and it could potentially change how we see and diagnose this super common problem.
Have you ever been in that situation? It's just so common. You go to the doctor, you get this big expensive scan, and the report comes back basically inconclusive. You end up with a diagnosis that feels more like a shoulder shrug than an actual answer. And that is the exact problem we're going to tackle today.
So there's actually a medical term for this. It's called nonspecific chronic low back pain, or NCLBP for short. You can think of it as a catch-all category, really. It's what doctors use when they've ruled out all the obvious stuff, like major structural problems. But the thing is, this leaves literally millions of people without a specific problem to treat. And that, of course, is a massive challenge for getting effective care. Okay, so here's our game plan for this explainer. We're going to start with the back pain puzzle itself, then we'll meet a really important muscle called the multifidus. After that, we'll put MRI and ultrasound head-to-head, look at what the study actually found, and wrap it all up with what this means for you. All right, let's get right into it. We're going to zoom in on a super critical but honestly often overlooked part of our anatomy. Say hello to the multifidus muscle. You can think of it as the spine's unsung hero. So what are these multifidus muscles? Seriously, think of them like the bodyguards for your lower back. They're these deep muscles that run right along your spine at every single level, kind of like small, powerful guide wires. They provide stability with literally every move you make. They're absolutely fundamental to your core strength. Okay, but here's where things go wrong. For people with chronic low back pain, these super important muscles can actually start to waste away and get filled with fat. The official name for this is multifidus fatty atrophy, or MFA, and it's a real problem because when fat replaces healthy muscle, that muscle gets weaker. It just can't do its job of stabilizing the spine anymore, and that's when this vicious cycle of pain and dysfunction can really take hold. And these two images right here, they perfectly illustrate the challenge we're talking about. On the left, you've got an ultrasound, and on the right, an MRI. Now, both of these are looking at the very same muscle. But the big question is, which one gives us the more useful picture? This is the core of our diagnostic showdown. So, this brings us right to the main event. It's MRI versus ultrasound. We've got two powerful imaging technologies, each with its own pros and cons, basically competing to give us the best look at what's really happening deep inside the spine. All right, so in one corner, we have the heavyweight champion, the MRI. It's the gold standard, right? It gives you these unbelievably detailed pictures and can clearly tell the difference between fat and healthy muscle. The downside, it's super expensive, it takes a long time, and you're not exactly wheeling an MRI machine up to someone's bedside. Then, in the other corner, we have the challenger, ultrasound. It's cheap, it's portable, it's fast. But the million-dollar question, the one this whole study wanted to answer, is simple. Is it accurate enough to be trusted? And that really is the heart of the question from the research by Gallfeld and his team. Can this simple, accessible, much cheaper tool give us the same critical information as the big, expensive gold standard? I mean, if the answer is yes, that could completely change how doctors approach back pain on a day-to-day basis. So how'd they do it? The researchers' plan was actually pretty clever and straightforward. They found patients who'd already had a recent MRI, then they did an ultrasound on the exact same spot, specifically right at the spinal level where the patient said it hurt the most. Then it was all about comparison. They looked at the MRI and the ultrasound side by side and measured two key things: how much fatty atrophy was there, and what was the overall size of the muscle. Okay, so the moment of truth. What did the study actually find? Well, the results were surprisingly clear, and they tell a tale of two very, very different measurements. Okay, let's talk about this number first, 0.83. This is a statistical score that measures agreement. Think of it like this. A perfect match is a 1.0. So a score of 0.83, that is considered almost perfect. What does that mean for us? It means for detecting that fatty atrophy, the fat getting into the muscle, the ultrasound did an incredible job. It was basically just as good as the MRI. That's a huge finding. But then there's this number, 0.07. When it came to measuring the overall size of the muscle, the agreement between ultrasound and MRI was, well, there's no other way to say it, it was terrible.
The official rating was poor. The two technologies were giving them completely different numbers, not even close.
And this little table really hammers home that first point about fatty atrophy. Just look at the numbers here. When the MRI saw no fat, grade 0, the ultrasound saw no fat. When the MRI saw a lot of fat, grade 2, the ultrasound saw the same thing. And for those cases in the middle, they agreed on almost all of them. The agreement was just consistently strong, right across the board.
You know, the researchers really summed it up perfectly themselves in their paper. The bottom line is this: ultrasound is a really reliable tool for seeing what the muscle is made of. Is it healthy tissue or is it fat? But it is not a reliable tool for measuring how big that muscle is. And that is a very specific and a very important distinction to make.
Okay, so the verdict is in. It's pretty clear. But what does this actually mean for you or for patients and doctors who are dealing with this kind of pain day in and day out?
So let's break down the key takeaways. First, and this is the big one, we now know that ultrasound is a reliable and accurate tool for spotting that multifidus fatty atrophy. That's a huge step. Second, we know it's not reliable for measuring muscle size, so we don't use it for that. Now, MRI is still going to be the gold standard for getting the full picture, for sure. But what this study does is it opens the door for ultrasound to become this amazing, cost-effective tool that a specialist can use right there at the bedside to quickly check on muscle health and even track how a patient is doing over time with their treatment.
But wait, there was one more really cool, fascinating little detail tucked away in this study. The researchers mentioned that when they physically pushed on the patients' backs to find the sore spots, the areas that were the most tender to the touch lined up perfectly with the spots where the MRI and ultrasound showed the worst fatty atrophy. Exactly the same place.
And that leaves us with a pretty provocative final thought, doesn't it? After all this talk about high-tech imaging, expensive MRIs, and advanced diagnostics, what if one of the best clues to a specific cause of back pain isn't on a screen at all? What if it can be found with a simple physical exam? Could a doctor's trained touch actually be the key to unlocking this whole back pain puzzle? It's definitely something to think about.